And when I became aware of the lateral approach, all of a sudden things just opened up. All of a sudden here, this was the first minimally invasive technique, which was less time than my open standard techniques, better clinical outcome, fewer complications, is a win-win all the way around. What a remarkable change in what I was able to do for my patients. That instead of struggling through this, instead of disrupting normal tissue, all of a sudden we're able to get down to the pathology, deal with the pathology without ripping apart the entire spine. As my practice evolved, we started going from just the young, healthy, degenerative population to that elderly, degenerative scoliotic population. That historically my treatment was really worse than their disease. That to go in for these elderly patients, do a big posterior operation, ripping apart the spine, bilateral pedicle screw fixation, these patients, their morbidity was overwhelming. It was worse than what they started with. So 10 years ago, those patients that would come into my office, I would turn them away. I would say, I'm going to hurt you, stay away from me. Now with these minimally invasive techniques, lateral approach surgery, these are some of my happiest patients. These elderly patients now come to me, and I look at them and think, goodness gracious, I'm going to help this person. They're going to be a happy patient. I'm going to be out in the public domain singing my praises. The single group of patients now have become my single biggest source of referrals. They refer me more patients than the neurology group, the PM&R group, the pain specialty group. The single group of patients now are referring more patients to me, more surgical patients than any single group. Historically, if we look at lumbar fusion patients, we help them, but what do they remember? They remember it took 1-2 years before they could comfortably bend over and tie their shoes. They tend not to remember their surgeon that favorably. If they have another problem, they don't think, well, I can come and have another surgery. They just remember how horrific it is. Now to have that same set of patients now referring their friends, their family, their coworkers to me, that's a significant sea change in what we do. Something's different in what we're doing now. And it is, I believe, from the lateral access, we're able to reconstruct the spine, attack the pathology, allow the normal structures, the normal ligaments, normal muscles to be our friend. We're not disrupting them to get in and take care of the pathology. A huge, huge difference. Other benefit, time-saving benefit, those outpatient surgery center patients, I don't have to round on the next morning. They're already home. I get a lot fewer nursing calls when patients are home than the patients that remain in the hospital. Another huge benefit. As these patients are doing better, patients understand. If I can take care of the same problem through an incision 2 centimeters long instead of 20 inches, patients understand that. And so as a marketing tool, it's a very, very powerful instrument.